Hi, I'm Christine. I'm one of the pharmacists here at Midwest Compounders Pharmacy. Today we're going to go over the injection technique for a subcutaneous injection. That just means an injection that goes under the skin. Let's get started. You may have received your prescription by mail. Once you unpackage it, you'll notice that we include a pack of 10 insulin syringes. We also ship your medication overnight on ice to ensure that it stays within the desired temperature range. During the summer months, you may notice that your vial feels warm to touch. That's okay. We routinely check our shipping processes to make sure that your prescription medication is within range. For storage purposes, place this vial in the prescription vial and keep it in the fridge. Now we're ready to draw up your dose. Pop the cap off the top of the vial. Once you take it off, it does not go back on, so you can throw it away. Anytime you draw medication out of the vial, swab the top of it with an alcohol swab. The syringe is dosed in units. Pay careful attention to the directions on your prescription label, as it will tell you how many units to draw up to get the correct dose. You'll remove the bottom cap from the syringe. For demonstration purposes, we're going to use a dose of 10 units. Pull the plunger down to the number of units you are to inject. Remove the orange cap, find the center of the rubber stopper, and push the needle in. Depress the plunger. You have now equalized the pressure in the vial, and we're ready to flip it upside down to draw up your dose. Take care not to touch the needle, the top part of the syringe, or the inside of the plunger. To draw up your dose, you're going to go a little past where your dose mark is. Sometimes air bubbles will follow that plunger down. Just give them a flick to get them to the top and push up to your dose. Now we're ready for your injection. You can set your syringe on the alcohol swab as you prepare the injection site. Most common injection sites include the top outer thigh and the area around the belly, staying at least 2 inches away from the belly button. To prepare the injection site, use the alcohol swab to swab the area by starting in the center and going in circles, working your way out. Pinch the skin, go straight in with your needle, push down the plunger, and hold for a count of 3 seconds. After the injection, be sure to dispose of your needle in a hard plastic container, such as a sharps container. Let's talk about what to expect from your GLP-1 medication. Most common side effects include heartburn, nausea, and constipation, followed by headache and fatigue. If you experience anything outside of these side effects, it's recommended to speak to your doctor or pharmacist. To help reduce the potential for side effects, we recommend smaller, more frequent meals. Anything too heavy, greasy, or spicy can increase your risk for heartburn and nausea. It's also not recommended to skip meals while on this medication. That can cause a drop in your blood sugar, leading to headache, fatigue, and nausea. So make sure that if it's been a few hours since you last ate, have a few bites of something, even if you don't feel hungry. You want to really increase your fiber and protein while on this medication. Fiber does a couple of things to help you be successful with your GLP-1 medication. It helps to stabilize your blood sugar. When our blood sugar is more stable, we feel better. If our blood sugar is going up and down, that's when we are at increased risk for side effects. We also want to make sure that you're getting plenty of protein in your diet. We want you to make sure that you retain as much muscle as you can, and also staying active is going to help you keep your muscle. One important point too is to make sure that you stay hydrated while taking GLP-1 medications. Water, tea, and broth are all hydrating, so we recommend buying a big water bottle and just carrying it with you everywhere, making sure that you're filling it up a few times a day. If you're struggling to get enough water, tea, or broth in, you can also do things that can help enhance hydration. Adding things like Celtic salt, chia seeds, citrus juice, fresh squeezed limes or lemons or oranges, can all help enhance hydration. You can also use the electrolyte packets as well. Just watch for artificial sweeteners or sugar content. We also recommend supplements that can help improve your metabolic health and help you to have success on a GLP-1 medication. The MWC Daily Nutrients has all of your baseline nutrients. This will make sure that you don't go deficient in any of these, but also it has activated B vitamins. Those active B vitamins help support mood, energy, and metabolism. There's also a low dose of CoQ10 in here, which can also help enhance energy production and help you be successful with the GLP-1 medication. Next, we have magnesium glycinate. Magnesium is one of my favorite supplements. It literally helps with all of the metabolic functions in the body. Taking 2 of these or 3 of these at night can help promote restful sleep, help improve mood and muscle relaxation, and then just support your overall metabolism. Next, we have the omega-3 Complete. These omega-3 supplements will help reduce inflammation, support your heart and your brain health. And then lastly, we have the daily probiotic. This probiotic is designed to help squeeze out those bad guys in the gut. We do know that the GLP-1s can decrease the diversity of your gut bacteria, so making sure that we're supporting our overall gut health by increasing fiber, staying hydrated, and taking a good probiotic is a great start. If you're using GLP-1 medications for weight loss, just remember it can be a little bit of a journey. Some patients may start to see the results as soon as that first dose. Some patients may need to titrate up to that second or third dose titration before they start to see the effects. Just remember that at a maximum, you want to be losing 1 to 2 pounds per week. Anything more than that can be hard metabolically on your body. Remember that slow weight loss is easier to sustain long term. What's nice about the compounded version is that you have dosing flexibility. What I mean by that is that you're drawing up the dose yourself, so you can follow a customized dose titration schedule that you and your prescriber decide would be best for you. We hope you had a great experience at Midwest Compounders Pharmacy and will consider us for all of your compounding needs. We also offer a full line of professional grade supplements, consultations both hormone and functional, and also functional lab testing. Please visit our website for more information. Thank you for letting us be a part of your journey to better health.